Okay, so biofield therapy. Biofield is really the like the shell of energy and information that surrounds your body. And I said part of that, as I mentioned before, was the electromagnetic field that is produced by the heart and the brain. They are providing energy about what is going on in your body. And remember, it's going out like several feet. So that means what is going on inside my body and my brain is affecting what is going on inside your body and your brain. So that's the biofield. It's not just the electromagnetic field of these organs. There are other components that we don't yet understand, but that's definitely one of them. And biofield therapies are ones that have the possibility to change those frequencies of those biofields, and by changing the frequency of the field around you, it would change the electrical activity of the heart and the brain, and therefore change the physiology of the body. Well, Reiki means universal life force energy, and it was developed in Japan, and it's a healing modality, a non-invasive healing modality, and it relies on the belief that there is some external source bigger than us, and the energy from that source can be channeled through us, and then it comes out of your hands or out of your eyes or out of your heart, and then it can help heal people. It's very good at making people relax, reducing anxiety, reducing pain, and no one knows exactly what this energy is. It hasn't really been satisfactorily measured at this time, but what we do know is that it can definitely affect people's physiology. Well, actually, it's more than just calming down. Yes, definitely, most people after they've received Reiki, they feel relaxed. But it does whatever is needed. So, for example, maybe you are tired and you don't want to calm down because you're already tired. You want more energy. So then the Reiki will give you more energy. So it kind of tunes into what it is that you need at that time. So what Reiki does, it tends to it balances the body. If something is out of balance in the body, maybe the hormones or maybe the nervous system, the Reiki will balance it, bring it back to balance again. So that is consistent with what I was saying before about someone who's tired needs more energy, and someone who is hyperactive needs calming down. I was working as a professor of physiology at the University of Arizona, and I was doing some experiments on rats. And I was doing my experiments. I had one group that would receive a treatment and another group that would not receive the treatment as a control group. And I was finding that the treatment, which in fact was I was testing blood substitutes, hemoglobin-based blood substitutes to use for transfusions. And I was one of the people who found out that all of these substitutes were causing inflammation in the intestine, and I found that out in the rats. So I would give them the blood substitute, and then they would show inflammation in the intestine. And as a result, none of these, not just my experiments, but the ones on humans as well, none of these products were ever approved for use in the US. Anyway, so I would have my rats, the control rats would not receive the substance, they would receive saline, and they did not show inflammation. Then I moved my lab to a different place on the campus, and my experiments didn't work anymore. All of the rats were inflamed. It didn't matter if they received the blood substitute or if they received the saline. They were all getting inflammation in the intestine. And the only thing that had changed was where I was keeping the rats. So the new place was much more busy and noisy compared to the older place. People coming in and out, slamming doors, machines starting up, and I thought maybe the rats are stressed. And so I did actually get a grant from the National Institutes of Health to study that. And I found out, yes, the noise was causing the rats to be stressed, and it was manifesting itself in the intestine and causing inflammation. So at that time, I needed to get someone to help me analyze the data. So I hired a woman, and it turned out that she was a Reiki Master. And I had never heard of Reiki. I had no idea what it was. And so she explained what Reiki was to me, and she said, you know what, maybe we should give Reiki to the rats to see if it reduces their stress. And so we did set up an experiment, and we did get a grant from the National Institutes of Health, a 2-year grant to do these experiments. And we had different groups of rats. One group of rats would receive, be in a noisy environment and receive Reiki. Another group of rats would be in the noisy environment and not receive Reiki. Another group of rats would be in the noisy environment and receive something called sham Reiki, where someone was pretending to give them Reiki, but they weren't trained in Reiki. And then we'd have one group that were in a quiet facility. So we had these 4 groups of rats, and then we could measure whether the inflammation caused by the noise was reduced by the Reiki. And yes, we found a significant reduction in the inflammation in the Reiki group compared to the sham Reiki group and the noise alone group. And that was the thing that really got me started on Reiki. And in fact, it completely changed my whole career. So in these experiments, we had the rats, they received the noise. We know that noise makes them stressed, and we could see that increased their blood pressure, increased the heart rate. And then we decided to see if giving them rats Reiki would stop the noise from causing those changes in blood pressure and heart rate. And we also had a sham Reiki group once again as a control. Actually, these experiments, the rats were their own controls, because the same rats got the Reiki and then they got the sham Reiki, and we compared the results. And we found that the rats that got Reiki, the heart rate significantly dropped. It didn't go up as much when they received the noise as the ones that did not receive Reiki, as the ones that received sham Reiki. So Reiki was having an effect on their heart rate. A pilot study, once again, we had 15 people in each group. So we had a group that received Reiki, a group that received sham Reiki, and a group that received standard care. And these were people who were going in hospital for total knee replacement. So they would receive the treatment, whether it was Reiki or sham Reiki, the day before surgery, the day after surgery, 2 days after surgery, and if they were still there, 3 days after surgery. And we were interested in their anxiety levels, their pain levels, also blood pressure, and then their use of medication, their dosage, pain relieving medication, and how long did they stay in hospital. And we found that the Reiki group, compared to the other 2 groups, compared to sham Reiki and control, the people in the Reiki group, their pain was significantly less, their anxiety was significantly less, their blood pressure, most of them had high blood pressure because they were very agitated when they came in, very nervous. That went down significantly. And interestingly, the dosage of medication that they needed was less significantly, and they got out of hospital faster. And I think that's a big one, because if hospitals are wondering whether or not it's worth having people to do Reiki on their patients, like having surgery, then if they find that there's evidence to show that the people don't stay in hospital for so long, then that would be a real benefit to them, a real motivator, because then they would not have to pay so much for each patient. It's copying what the Reiki practitioner would do, like putting your hands where they would put their hands, but without the actual energy, without the Reiki, without knowing anything about it. Well, sometimes they have like a no treatment group and a Reiki group, but even that is not sufficient, because just someone paying somebody attention, being with them, can have an effect. So it's no good just no treatment and Reiki. That's why you need the sham Reiki or some other modality to compare. Yes, I think it is getting more popular, and hospitals are using it too. In fact, there's a publication, I think it's called Best Hospitals in the US, and I think they said that 60% of those best hospitals have Reiki programs. I think possibly the reason is that people are getting more and more stressed in the world that we live in, and having Reiki helps you relax. It really eases the stress. And Reiki isn't a replacement. I mean, you would still want the drugs, but the Reiki adds to what the drugs are doing. Because if you're more relaxed, the drugs work better. And also maybe you can kind of reduce the dose of whatever it is that you're taking, and then eventually maybe you don't need the drug to reduce your blood pressure anymore, because the Reiki is doing that. But no, I'm not saying that Reiki is something to take over all the normal Western medicine. I'm saying it can be used in addition, particularly as a stress reducer, relaxer, pain reliever, and it's very good at reducing anxiety, which is very common when people are sick. Okay, so we have evaluated, I think, over 100 papers now. And we have found that a lot of the papers are what's called pilot studies. So this is a weakness in the research. Pilot studies, meaning that they don't involve large numbers of people. But based on the pilot studies and some other more large-scale studies, there are certain trends that are appearing. And so Reiki looks promising as a modality for healing pain, reducing pain from different types of pain, like pain resulting from surgery, or pain resulting from arthritis, or pain, all kinds of pain. So Reiki works on different levels, both on the physical body, on the emotional body. So that's how it works with like anxiety and depression. So it works on the emotional body. Also, people use it as a spiritual practice as well. So it works on all these levels. And going back to the Touchstone project, as I said, we need more studies now with larger numbers of people. But already we do have a fairly robust database of these mainly pilot studies that do show that Reiki is promising in areas of anxiety, pain reduction, improving well-being, and also reducing burnout. Yes, and that's one weakness of many of the studies is lack of number of people in each group. The other one is lack of a proper control group. Those are very, very important. We still don't know for sure how it works. There's no mechanism. And scientists are very, very skeptical if there's no mechanism that has been proved. They say, how can it work? There's no mechanism. So we will just ignore this thing and shut the door on it. Unfortunately, I don't think I agree with that, because, for example, aspirin was used for 70 years before they knew the mechanism of how it worked. And it was very effective. So we say that Reiki is very effective under certain conditions to reduce anxiety, to reduce pain, to improve well-being. And why not use it until, before we find how it works? And so hopefully one day, hopefully in the near future, we will know the mechanism, because once we have the mechanism, then it will get much more widely accepted. Yeah. So in Reiki, depending on what branch of Reiki that you're trained in, but in Usui, which is what I'm trained in, there are 3 levels of Reiki. There's Reiki 1, the first level, where you can do Reiki on yourself and on other people, hands-on. There's level 2, where you can send Reiki across distance. And then there's Reiki Master, level 3, where you can teach people. So in our experiments, we usually get Reiki Masters to do the Reiki. You can do Reiki both hands-on and hands-off. You can even do it from a distance. And when we were doing experiments with the rats, so the rats were in their cages, and we just had the Reiki Master sit outside the cage and just direct the energy to the rats who were in pairs in the cages. So of course, when people have Reiki, they're not in cages. So when people have Reiki, they usually lie on a massage table, and then they receive Reiki. They can either have the hands on. So when you give Reiki, you channel the Reiki through you, and you can place the hands on the person in different positions. Or the person has the choice of, if they don't want to be touched, they don't have to be touched, and you can just put the hands nearby, close to the person. So that's really how you receive the Reiki. You can do it for as long as you want. If you're having an appointment, usually people ask for maybe half an hour or 1 hour, but you can do it however long you want. When you learn Reiki, you have what's called an attunement, and the Reiki Master who is teaching you will do a ceremony where you are attuned to this energy. And as I said, we don't know where the energy comes from or what it is exactly, but you are attuned to the energy so that you can connect with it. Like you think Reiki, you connect with it. So when I think Reiki, I usually breathe. I imagine I'm breathing the Reiki in through my crown. And then I feel changes in my body. So I feel usually some kind of like tingling sensation. So when I was doing Reiki on the horse that you saw, when I started the Reiki, you could see how it affected my heart rate. You could see how my heart rate was going up and down in a pattern. And also it was affecting how I felt in my body. I could feel kind of tingling in my body. People are different. Different people feel different effects of Reiki, but that's how I know I'm tuned into the Reiki. And then I can place my hands on a person or an animal, and then they will receive it from me. Oh, it's wonderful. So even if you're Reiki 1 and you're giving Reiki to somebody, as I said, the Reiki is flowing through you. You're attuning yourself to the Reiki. It's flowing through you and then to the other person. And if you are nervous or anxious for some reason, you'll just feel relaxed and calm. So likewise, if you're feeling tired, then it will give you energy. You might think, okay, well, if someone's a Reiki practitioner and they have like 6 clients in one day, by the end of the day, they must feel very tired. No, because it's not your energy that you're using. It's an external energy that's coming through you. So that's another benefit of Reiki. You're not using your own energy.